Sinusitis is probably the most common complaint I see in my practice in ENT. About 1 in 8 Americans will actually develop a sinus infection each year. That's 31 million Americans. 20% of all antibiotics prescribed are done for a sinus infection, and it's the most common diagnosis that requires an antibiotic as an outpatient. Okay? So as far as our sinus anatomy, we all have 4 paired sinuses. They're embedded in the skull, and there's 1 pair above the eyebrow and the forehead. There's another pair above the teeth. You have another pair in between the eyes, and then behind the eye there's another pair. So what the sinuses do is they're filled with air and they're lined with a small membrane that is connected to the nasal cavity. So they felt to have several functions. We know for sure that the sinuses help to filter, moisturize, and humidify the air that we breathe. They're basically there to protect the lungs. They're sort of the gatekeeper for the lungs. That's why when an asthmatic has a sinus infection, their asthma will also act up as well. So we know for sure the sinuses do that, but it's also postulated that they perform several other functions. So because they're filled with air, they lessen the weight of the skull, so there's less weight for the neck to carry. They also protect the brain and the eyes and the spine from trauma. So think of it as like a built-in airbag for the face. And if there's blunt force trauma to the forehead or the mid-face, the sinuses will break and cave in and can bear the majority of that trauma, protecting the eyes, the brain, and the spine. So I've seen many terrible motor vehicle accidents where patients got their face crushed in, and yet their brain and their eyes and their spine were spared. So other postulated functions are they are felt to help resonate the voice. They're also felt to improve our sense of smell, and there are some natural antibodies located in the lining of the sinus, so it's felt to also provide immune function. The definition of sinusitis is when there's inflammation in the lining of the sinus. And this is usually brought on by acute nasal congestion. So the sinuses are normally lined with a small membrane that's filled with air. And when there's a sudden onset of acute congestion, the sinuses can't drain and they'll back up and they'll fill with fluid.